Hi, and welcome to Seasonal Challenges with Lupus. I'm Annika Hazlitt, a member of the Board of Directors of Kaleidoscope Fighting Lupus, and your host. At this time of year, winter cold can wreak havoc on your immune system, increasing the risk of infections and flares, and adding to your muscle and joint pain. Even the stress of social obligations around the holidays can increase your lupus symptoms. Here with a wealth of pro tips and professional advice to get us through the chilly season is our friend, Dr. Sharon Dowell, clinical rheumatologist and medical director of rheumatology at NEA Baptist Memorial Hospital. Before we hear from Dr. Dowell, I'd like to thank our presenting sponsor, GSK, for their generous support in making this video possible. I would also like to thank our community sponsors, Blue Eyed Crow Studio, Tin Rocket, 7 Minute Cinemas, and Due North Studios for their continued support. Now, let's hear from Dr. Dowell.
Hi everyone. Thank you for listening and for watching today. I want to talk to you about the impact of the winter and its effect on lupus, and how should you prepare yourself for the winter months so that you are in your best health. Now, I know that some of you are asking the question, why does this matter? And I hope that by listening today, you will understand that the winter and the weather can have a significant impact on your lupus disease and on what can happen. For instance, did you know that more people with lupus have a higher frequency of lupus flares during the winter? Well, it's true. And those flares can lead to hospital visits, and some people can have pretty bad outcomes. So it'll be good to know what you can do to protect yourself. Now, some of you may already know this. You may already know that when it's cold and wet, you have increased muscle and joint pain. But other things can occur as well. There is pretty good evidence that lupus flares are more frequent during the winter, and that the weather can have an impact on how you feel and on specific types of flares. Regardless, it is clear that the environment can be impactful. There's still a lot of speculation about why and how this happens, but it means that you should not let your guard down during the winter, as you may be likely to do because of the festive nature of that holiday season, and that you should continue to be very vigilant and be very intentional about how the environment and your activities can have an impact on your body. I'll talk specifically about a few things, and one of those things is Raynaud's phenomenon, or Raynaud's disease. Now, this is a cardinal feature of many autoimmune conditions, especially lupus. It is caused by this abnormal and really intense constriction of the blood vessels in the extremities, particularly the hands and the feet. It can be primary, so what that means is that it can occur without any known cause. That usually tends to be mild with no really severe consequences. In lupus, we're talking about secondary Raynaud's phenomenon, and that is when it's caused by some other disease or occurring in the setting of some other condition. It's characterized by this sort of intense color change in your fingers or in your feet with exposure to cold. And we know that there are 3 particular color changes. We have the initial white attack, so your fingertips or some part of your hand may turn white, and that's due to the vasoconstriction of the vessels. And then there is the blue attack. So you go from white to blue, and that occurs because there is what we call tissue hypoxia. And what that means is there is lack of oxygen in the fingertips because you're not having that blood flow. Eventually, blood flow returns, and then you get a change to red. So it may become very red and warm and flushed. And this part can be intensely painful as blood rushes back into the fingertips. In severe cases, patients who have really severe Raynaud's disease can actually have damage to the skin of their fingertips or to their toes because of that lack of oxygen. And we call that damage is due to what we call ischemia, and that damaged skin can ulcerate, can become secondarily infected, and people can actually lose their fingertips, so they can have amputation due to what we call gangrene. So this is significant. And because it tends to be promoted or to occur in cold situations, it is more frequent in the winter months. So what can you do to protect yourself against that if you have Raynaud's disease? Well, it's pretty simple. The first thing is making sure you keep yourself warm. And that means perhaps being aware and limiting outdoor activities where you may not have good cover or where you know it's going to be intensely cold. Additionally, there are other simple things you can do, like wearing gloves, wearing layers when you go outside to make sure you keep your core warm as well. Some people may use hand warmers, and now there are some of these really phenomenal inventions where you have like battery powered hand warmers that you can leave in your pockets so that you can keep your hands warm during the winter months as well. Another thing you may think about is what activities may perhaps make Raynaud's phenomenon worse. Now, there are some medications that can do this, and so you should review your medications with your doctor, so be aware of that. And then smoking, alcohol use, they can also affect Raynaud's and make it worse. So you want to limit that, as it's not really good for your health in any case. You want to keep yourself well hydrated. And if you have severe and frequent episodes, go ahead and talk to your doctor, because there are some medications that may actually help with that blood flow to your fingertips. Frequently, calcium channel blockers can be used, and so you can talk to your doctor to see whether that may be a good choice for you. Additionally, in the winter, there is a really high chance of respiratory infections. And this is really well proven. We know that there is seasonal variation with lung infections, particularly those due to influenza or the flu, COVID, which is a new threat, or not quite so new, and pneumonia, bacterial pneumonia. And so you may ask yourself, well, what can you do to protect yourself against it? Well, one really easy, quick fix is to make sure that you get yourself vaccinated well in advance of the winter season when these infections are more common. And there are vaccines for the flu, for COVID, and for bacterial pneumonia. Talk to your doctor to make sure that these vaccinations are scheduled and that you have them done at the right time. Some of you may be concerned, and I know that there are some murmurings out there that vaccines can actually cause lupus flares. But really good data, especially related to the COVID vaccine, has really shown no evidence that getting these vaccines will lead to a severe lupus flare. And so it's safe for you to get vaccinated. Additionally, there are a couple of simple measures that you can take for yourself. You may want to try, if you can, to avoid crowded events where you're not certain of who you'll be interacting with. If you have to go to a family gathering, and I saw this on the Lupus Foundation's website, you should try to avoid shaking hands. And if you do have to shake hands, make sure you have some hand sanitizer present. I think one tip that they gave was that you could try to maybe have a beverage in your hands at all times so that you can have a really good reason not to be shaking multiple hands. As we know that a lot of these infections can be transmitted by contact as well. Another thing to consider is wearing a mask. And I know this may be a little bit awkward for some people, but do your best to be proactive for your own health and to protect yourself. Many of you who have lupus are probably taking medications which suppress your immune system, and that puts you at risk of getting an infection a lot easier than someone else. And oftentimes, you can also have more severe infections and worse consequences. So be proactive on your own account. Another threat with the winter is the weather itself and the conditions that it can cause. So you have to be careful because it can be dark, icy, and slippery. We know that during the winter, there is an increased risk of falls. And an increased risk of falls means that there is an increased chance of having a fracture if you should fall. Persons who have lupus, especially those who have been on corticosteroids such as prednisone, methylprednisolone, there are lots of these names that you would recognize, have an increased risk of developing osteoporosis. And what that means is that you have brittle and fragile bones. Now, some of you may know this and may already be on medications to treat this osteoporosis. Unfortunately, screening for osteoporosis does not occur as readily as it should in all patients. Recommendations nationally or guidelines suggest that every woman over the age of 65 should be screened for osteoporosis. And additionally, if you have been on steroids for a long time, you too should be screened. Be mindful about this, and if you can, talk to your doctor to see whether this is screening that you yourself should undergo. Regardless, all of you, make sure you're taking calcium and you're getting your vitamin D in, because this is really important as well for your health. The recommendation for calcium varies by age and by sex, but try to get about 600 international units of vitamin D in every day. And note that there may be a higher requirement depending on whether you have osteoporosis as well. Now, no matter who you are, the winter months are special. There is a high concentration of work holidays, family gatherings, and perhaps travel. And this can throw you off your routine, at least that happens to me. And so you have to plan for it. You have to plan to be consistent with your diet, avoiding processed foods, high sugar and high calorie foods. You need to make sure you get adequate hydration. You have to plan to be consistent with some exercise. Remember that probably exercising indoors would be better than exercising outdoors so that you're avoiding that cold exposure. And if you're traveling, plan to travel with more medication than you think you will need in case of travel delays, which can occur during the winter months as well. Some things to help with this would be using a pill box. Consider having an app on your phone to give you reminders about taking your medications, because you don't want to get off your routine for good health. If you can avoid it, try to limit your alcohol intake. Alcohol, as we know, can interact with medications and it can lower inhibitions, which can predispose you to other things. So it's good to try to limit alcohol intake during this season. And then remember that although it's the winter months, we have less UV ray exposure, you still have light exposure. And so you should still use your sunscreen when you go outdoors. This is very important. The other thing to consider is that, although I like winter, I will admit that those dark, cold days can be miserable. And depression rates are higher in the winter months. The days are dark, you're unable to get out sometimes, and that can be very isolating. So talk to your doctor about this ahead of time if you know it's a period that is difficult for you, or if you're dealing with feelings of depression even before the winter starts. Remember, as always, to surround yourself with people who uplift you and who support you, and ensure that you're part of a community that would aim to help you, such as Kaleidoscope Fighting Lupus. So in summary, the winter months are coming, and just as we winterize everything else in our homes, we need to winterize ourselves. So you need to keep warm, and you have to plan for that and be intentional about that. Be proactive about Raynaud if it's something that affects you. If there's a medication or a habit you need to stop, or is there a medication or habit you need to start? Get your vaccines. Remember to avoid live vaccines like the nasal flu vaccine. And with the vaccinations, depending on what medications you're taking, there may be some considerations about when is the optimal time to get your vaccination. Some medications may need to be held around that time. Supplement with vitamin D. The recommended dose is between 600 to about 800 international units per day, and this is really important for your health as well. Eat well, exercise, and take your medication on time. Remember as well to use sunscreen when you're going outdoors, because although the sunlight is weak, it's still present. And finally, make sure to join a support group and surround yourself with positive people. I'd like to thank Kaleidoscope Fighting Lupus for their continued efforts to educate and support persons living with lupus, and for giving you the tools to be proactive and to be full partners with your providers in managing your lupus disease. Thank you for listening.
Thank you, Dr. Dowell, for those great tips on getting us through the winter months. We hope that you found seasonal challenges with lupus helpful and that you share this video with others in the lupus community. Once again, a special thanks to our presenting sponsor, GSK, for their incredible support in making this presentation possible. You can find more great lupus resources on GSK's Us in Lupus website by using this QR code. Thanks as well to our community sponsors, Blue Eyed Crow Studio, Tin Rocket, 7 Minute Cinemas, and Due North Studios for their ongoing support. And we want to thank you for watching. We encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, award-winning blog articles, and so much more. Thank you for spending time with us. And remember, you're not alone. I'm Annika Hazlitt for Kaleidoscope Fighting Lupus. Please take care.